Pilonidal sinus is a disease which occurs due to infection. So, infection in the region between the two buttocks. It's called as the ladle cleft. Infection here happens because of hair getting trapped in the pits in between the two buttocks. So, due to trapping of hair, this area gets infected and forms sinuses. Patients present with pain and discharge in this region. Sometimes they have a pus formation that is called as abscess. So, this is a very common problem. Some patients have very mild disease, some patients have very severe disease. So some patients have multiple openings, multiple pits, some patients have very few pits. So this is a recurring problem. So patient will develop an abscess, a pus, it will drain. After a few months, it will again recur. So this is a recurring problem. During the acute phase when they have infection and abscess, surgery is done to drain the pus or give antibiotics and painkillers. So ultimately most of these patients will require surgery. The surgery is the only effective treatment for pilonidal sinus. So there are many options. So conventional surgery where when we excise the entire diseased part till the bone and close it by sutures or by using a flap. So local flap is used to cover the defect after excision. Recently, last few years, we have a laser surgery for pilonidal sinus. In last 7 to 8 years, so lasers are used for treating this pilonidal sinus. So most of the patients we advise to do an MRI scan before the surgery or an ultrasound scan before the surgery to identify how many pits they have, what are the lateral extensions they have, etc., the branches of the sinuses, etc. And then we plan the surgery by laser. So we use a 1470 nanometer laser, a radial laser fiber for treating the pilonidal sinus. This is very effective treatment for all forms of pilonidal disease. Prefer to do a laser surgery when there is no active infection or pus. So once the infection subsides, then this will work better. So this is very simple procedure. The operation doesn't take much time. The laser surgery doesn't take much time. The wounds are very small. The laser surgery can be done under spinal anesthesia or local anesthesia or a short GA, intravenous anesthesia. Recovery is very fast. The patients can go home on the same day. There is not much of post-operative wound care as the wounds are very small. So we don't make big wounds unlike the conventional surgery. Post-operative wound care is very minimal. So the recovery is very fast. The patient can go home very quickly after the surgery and the pain is very minimal. The pain is very little after the operation. And it's very effective form of treatment. There is a chance of recurrence and it depends on like what stage of disease you are having, whether it is a simple single pit or multiple pits, long tract, side tract, etc. If you have a more severe disease, the chance of recurrence is higher because laser surgery is a blind surgery.